I would say this, that a lot of times if you have a question, if you have a concern, if you're not too sure, we're available.
Welcome to UC Davis Student Health and Counseling Services Aggies Talk Health podcast. My name is Varsha, and in today's episode, we'll be learning about the different mental health services that UC Davis Student Health and Counseling Services has to offer to our students. Joining us today is psychiatrist Dr. David Liu. Do you want to start by telling us a little bit about yourself?
Absolutely. My name's Dr. David Liu. I'm the Chief of Psychiatry here at UC Davis Student Health. So a little bit about myself. I was born in Taiwan, grew up in Cleveland, Ohio, first generation Chinese American. Spent most of my life out there. Actually did most of my training out there. Came on out here to California to finish up my training for a fellowship. And that's kind of how I ended up here in California.
And you talked to us a little bit about your pathway into medicine, but can you tell us why UC Davis specifically?
I've had the privilege to kind of work in different settings. My fellowship, it was a UCSF, SFVA joint program. Got to work with the veteran population. My work initially after that, I spent close to 9 years at the UC Davis Main Medical Center. Got to work with very broad patient population as well. Then really had the privilege to kind of explore some new opportunities. This popped up and I jumped right on it. This is a wonderful patient population. Really, I don't want to work anyplace else. There's no other place I'd rather be, in other words. I love working with this population, which certainly I imagine we'll get into more later. Here at UC Davis Student Health, it's a wonderful system. There's really tremendous leadership here. And ultimately, as I said, already, the patient population, the students here are truly a delight to work with.
And let's talk about the students further. Why did you choose specifically to work with students, and what's the most rewarding thing about having students be your patient population?
I think on a number of levels. I think really for me, it's working with these students, you recognize the resiliency and the courage of our young population. This generation, as with many, young generations, they're rather resilient, yet they go through a lot. And in the midst of that, they exercise tremendous courage in reaching out, in seeking help. We're on the receiving end of that. We're here to receive the students when they come and they ask for help. I think the other thing that really is wonderful is that this is a really unique and special time where when we really talk about psychiatric illnesses, such as anxiety, such as depression, and other sorts of psychiatric diagnoses, it's kind of around these years, in the late teens, early 20s, that a lot of these psychiatric illnesses, if they were to manifest, start appearing. And so this is really a unique opportunity to really offer services to address them in a very timely manner, instead of having folks experience these symptoms, be in distress, and then having to kind of wait a longer time than really desired to be able to access care.
Yeah, and let's turn a little bit into these general psychiatry questions. There's a lot of different types of providers within mental health care, and it might be a little bit overwhelming for students to decide which provider is right for them. Can you talk to us a little bit about the difference between counseling and talk therapy and psychiatry, and when to decide which is right for any particular individual?
I would say we are all along a continuum. We are all potential tools to be utilized in addressing your mental health care needs. When it comes to talk therapy, as the kind of term implies, a lot of it is, through kind of really evidence-based therapies that have been developed that have shown tremendous value in addressing, mental health care needs. When it comes to psychiatric services, really what we emphasize is medication management. We really strive to deliver here at Student Health, whether it's on the counseling service side or on the psychiatry side, is really engaging students where you're at. We're very, very open to receiving you, and we're here to serve.
Yeah, and kind of shifting away from that, case management teams are a very integral part of mental health care, I think. And UC Davis Student Health and Counseling Services has specialized case management teams for psychiatry. So what is the role of these teams in providing health care for students, and how do you work with them?
There's often a lot happening when trying to access care, and it's not oftentimes really clear kind of what direction or where you should be turning or kind of which doors you should be knocking on. One of the main roles that our case manager plays, and we have a dedicated case manager on our psychiatric service here, is really helping support students in navigating the greater system as a whole. What kind of therapy are you interested in? And our therapist really kind of takes all of that, and with her kind of knowledge of the resources available in the community, she will help the student navigate that path.
Let's talk a little bit about stigma. Even now, there's a lot of stigma and prejudice associated with mental illness. So how do you approach working with students who might be a little bit afraid to open up and be vulnerable due to fear of things like judgment?
Let me address it from this point of view. Our psychiatry service is a referral service, which means in order to access us, students have to access us through other providers. And really the two main paths to us here at UC Davis Student Health are our UC Davis Student Health primary care providers and our UC Davis counseling services. When we talk about stigma, I think really our partnerships with those teams really help to bring the students on in. Ultimately, it's through our partnerships with them and building a sense of trust in really the service that we're delivering that opens up these providers and even kind of saying, hey, listen, there is this option here. That we have these wonderful partners in psychiatry, and we would love you to engage with them. We feel that it would be valuable for you to engage with them, which I feel, again, as I said, really was through a series of really intentional kind of bridge building and collaboration, building of partnerships with these, partner groups that really allows, I think, that voice to be out there to say, hey, you know what? We have this really wonderful service here in-house that you could come and, see if it'll be helpful for you.
I think that sometimes it can be really hard for students and patients in general to know whether their mental health or their concerns are just part of the natural ups and downs of life, or whether it's a sign of some bigger medical problem. So what is some advice you have for these people to know whether they should even reach out for help?
I would say this, that a lot of times if you have a question, if you have a concern, if you're not too sure, we're available. Our services range from one visit check-in, hey, let's talk about this, and us helping you, support you, and kind of navigating and directing you to appropriate services, all the way to us kind of seeing each other much more frequently. Ultimately, if you have a question or you have a concern, we're here and available to address that.
I think that sometimes it can be hard for students and patients in general to know when their concerns are just part of the temporary natural ups and downs of life, or whether they're a sign of a bigger medical problem. So what are some uncommon yet valid reasons that students might make an appointment with you or your team?
I don't know about uncommon, but as I shared a little bit earlier, if you have concerns, we're here for you. We do appreciate how oftentimes external stressors, things going on in our lives, can definitely impact our internal experiences, our moods, our mental health, right? We'll say that, we have been seeing a noticeably greater increase in referrals for international students. This team was intentionally built with the vision to address and to deliver as diverse care as possible. each of these providers, they offer rather a unique ability to communicate. I don't know about, uncommon, but, again, we are here to serve you.
Well, Dr. Liu, we're out of time here, but we'd love to have you back for another podcast episode.
It's been a pleasure, Varsha. Would love to come back.
Wonderful. Then please do look out for that here on the Aggies Talk Health podcast YouTube channel. If you're interested in more information, please visit our Student Health and Counseling website, also linked in our description below.